Okay, continuing with types of eating disorders. Had one more slide left for anorexia about the course and prognosis. Some people with anorexia, it comes and goes. That same person that I was talking about in the previous clip, she would seem to have a relapse every year in the winter, fall. So she's had several times when she's gotten better. The Dr. Phil show sent her to a treatment center first because she became a drug addict and alcoholic, for rehab for that. And then when she started getting, when she stopped using drugs and alcohol at the rehab center, her eating disorder resurfaced as her coping mechanism. And so they sent her to an inpatient eating disorder center. And she was finally released. They released her into a halfway house. She was doing great, for 18 months. And then, the eating disorder resurfaced. She went to graduate school to become a counselor, and the stress of graduate school precipitated another episode of anorexia. So it does seem to be episodic. They seem to get better, and then they can relapse, in other words. Sometimes when they recover from the anorexia, they become bulimic because of their continued obsession with weight control. As far as the prognosis, they think that about 40 to 45%, are considered in recovery or recovered. A lot of them improve with treatment. For some it persists. The mortality rate is the highest of any psychiatric disorder, 10 to 15%. As far as the best prognosis, early age of onset, few conflicts with parents, and I would add to that getting treatment early in the course before the behaviors become entrenched. The things that are associated with a less favorable outcome or recovery, if they purge, if they're also bulimic, and again, long-term. So as far as bulimia, that's recurring binge episodes. Binges are eating large amounts of food within a short period of time, also with a feeling of lack of control, because a lot of people binge or overeat. Some of the terms are pigging out, but things like that. That's not necessarily pathological. It's just kind of human behavior for some people. But if you it's that sense of lack of control when you're eating a large amount of food, and typically within a short period of time, that defines a binge. Recurring episodes of compensatory behavior. So the compensatory behavior compensates for the large amount of food intake. Self-induced vomiting, laxative abuse, over-exercise. We'll talk about that more in a second. Use of diet pills, diuretics, some of these things don't really help with the overeating. Like, for example, laxatives don't really prevent the absorption of most of the calories in a binge. A diuretic is not going to, reduce the energy surplus from a binge. But there's some type of compensatory behavior for the binge. And then for the diagnosis, the binge purge has to occur at least once a week for 3 months. And I'll tell you, as someone who's worked with eating disorders, that most people with bulimia practice the behavior almost every day. But it's not necessary for the diagnosis. Self-evaluation, they're concerned by body shape and weight. There's a weight obsession with people with bulimia. Just as an added side note, for people with eating disorders, bulimia, anorexia, especially anorexia, there's a lot of self-checking. They weigh themselves multiple times a day sometimes, take their body measurements. A lot of times they look in the mirror a lot to make sure they have a thigh gap, things like that. So subtypes of bulimia, the purging type, they do self-induced vomiting, they use laxatives or diuretics, diet pills. Actually, some even abuse thyroid medications. I don't know how they do it because I've been, as someone with hypothyroidism, I've been over-medicated at times and it's miserable. Anyway, the non-purging types, instead of purging, well, they purge their excess calories actually by fasting or excessive exercise. And this is really difficult, the excessive exercise. People think of exercise as, virtuous and, something good, but it can become obsessive. If you're exercising for the express purpose of, on a regular basis, getting rid of excess calories, or if you're exercising despite being injured, those are clues. I've done talks on eating disorders where I've talked about excessive exercise, and people have come up to me afterwards and say, well, exercise is healthy. Well, at a certain point, it can be obsessive and unhealthy, especially the big clue is exercising to the point where it interferes with everyday life functioning, social events, work, things like that. And if you exercise because of major body image disturbance, and if you exercise despite being injured. Okay, so people with bulimia have a fear of gaining weight or becoming fat. A lot of, and this is something that's really important to acknowledge. You can have an eating disorder and be overweight or obese. If you don't purge often, if you binge a lot and don't purge often, you can be someone with bulimia and someone with obesity at the same time. People assume that, someone who's obese could not have bulimia, but I've seen case after case of people with who are obese with bulimia. But the self-worth is contingent on weight. Food is used as a coping mechanism. There's a sense of shame around the behaviors. They're not in denial. When you're, purging, that behavior is not normal. And there's a shame over the lack of control over eating as well. And then people with bulimia tend to have a high need for approval. They tend to be people pleasers, in other words. So here are some of the effects of bulimia on the body. As far as the brain, it's not physical effect on the brain, but, there's a depression, low self-esteem, a sense of shame. In the cheeks, there can be swelling. Depending on, if they purge by self-induced vomiting, sometimes there can be swollen salivary glands. A lot of cavities and tooth decay. Sometimes dentists can pick up on that. I have a picture in a second that shows a typical appearance of someone with long-standing bulimia, but within a couple of years, you're going to have major damage to the teeth. The throat, the person can become hoarse. The tear in the esophagus, and that's kind of a movie of the week type thing. When eating disorders first came out after Karen Carpenter's death in the early 80s, there were a lot of movies of the week about eating disorders, and there's always a stomach or esophagus rupture or something. That's not real common, but it can occur. Fatigue, delayed gastric emptying is of the stomach ones. That's the most common. Over time, with the self-induced vomiting, the peristalsis slows down, so there's a delayed gastric emptying. Now, this is something that a lot of people look for is abrasions on the knuckle from self-induced vomiting with, by putting the finger down the throat to trigger the gag reflex. But a lot of people with bulimia figure out how to purge without doing that. So if a person doesn't have, the sores on the back of their hand, from the teeth scraping against the top teeth, that's not, that doesn't mean that they don't have it. Let's see. Anemia can be an issue because you lose electrolytes with laxative abuse and self-induced vomiting. There can be an irregular heartbeat and fluid and electrolyte imbalance, especially dehydration with the purging. That can be an issue. Let's see. Constipation, irregular bowel movements. There can be an irregular period, but that doesn't always happen because people with bulimia do not necessarily become under fat. Here's the enamel wear on the teeth. You can see especially the front teeth start kind of chipping away. So, and this happens generally with aging, teeth tend to shorten, but with this, extreme shortening and chipping away, that's a sign of the enamel becoming weak and the teeth start chipping and becoming shorter. So as far as the lab findings, you really worry about the electrolytes because you lose electrolytes with self-induced vomiting or abuse of laxatives. And that can be deadly, as you know, from the vitamins mineral section. When potassium is low, the heart can stop and you can die. So as far as the prognosis, with good treatment, about 50% can recover. The mortality rate is lower than anorexia. With recovery, some can become obese or overweight. Things that are associated with a, better outcome, again, getting treatment early on before the behaviors become entrenched is important. And the absence of personality disorders. Personality disorders include, the most common with bulimia is borderline personality disorder, but there are two other personality disorders as well. But what I see mostly is borderline personality disorder being associated with bulimia. Now, that's only a small percentage that I see, but I do see that personality disorder. I see more depression and anxiety with bulimia. Okay, another diagnosable eating disorder is ARFID, avoidant restrictive food intake disorder. And the thing that differentiates it is it's not associated with that obsession with body weight and shape. But, it's an eating disturbance that's associated with inadequate intake, resulting in significant weight loss, nutrition deficiencies, and dependency on supplements to meet nutritional needs, and like a lot of addictive type disorders, interference of social functioning. One of the ARFIDs is called orthorexia, which is an obsession with eating healthy to the point where they stop eating, for example, animal foods because they could have cholesterol. They stop eating fruits because they could have sugar. They stop eating anything, they keep eliminating foods because they hear about, harmful health effects of certain foods. They just become really obsessed. There are people who have died of this. So some other things that are associated with ARFID, it's not because not adequate food is available. And it's not, it's not caused by some type of mental or physical disorder. So again, the orthorexia, is becoming more common where people are afraid of eating because of all the media attention on the dangers of different types of food and all the information that's out there about different diets. We're supposed to be afraid of gluten, lectins, all sorts of things. So they keep eliminating foods thinking that they're dangerous, and they end up malnourished. The other specified feeding or eating disorder, OSFED, which used to be called EDNOS, is someone who has disordered eating, but they don't quite fit the criteria for anorexia or bulimia. For example, they may not have been binging and purging the full 3 months, which is the one of the diagnostic criteria for bulimia. They may have, if it's a female, they may have regular menstrual periods, which is typically, people diagnosed with anorexia typically have absence or irregular menstrual periods. Let's see. They may do different compensatory mechanisms like chewing food and spitting it out, without swallowing. Let's see. And then binge eating disorder, this is kind of new to the diagnostic criteria, because people just thought of binge eating as a lack of willpower. But it is a true eating disorder. Recurrent episodes of binging, but not purging. Okay. So, it's kind of like bulimia without the purging. They feel that lack of control over eating. So one of the diagnostic criteria is that the binges are at least once a week for at least 3 months before it's diagnosed. And again, I talked about the characteristics of binges. You eat till you're uncomfortably full. You eat more rapidly than normal. You eat when not physically hungry. Tend to eat alone because you're ashamed of, eating. Not the felling, typo, feeling of shame, being depressed or guilty after eating. Okay. So the features, a lot of times some type of stressor will trigger a binge. There's a dissociative quality of binges. That means that, while you're binging, you're not thinking about your problems. Often people with binge eating disorder have a history of dieting and obesity. They get into that pathological cycle of dieting that we talked about in the obesity section. They do tend to be obese, but not all people with binge eating disorder are obese. They oftentimes have big weight fluctuations. Their eating interferes with social interactions or social behaviors, social events, their social life or work environment. And there's a higher rate of depression, low self-esteem. Somatic concern is, a preoccupation with body weight, and they tend to be highly sensitive people. In fact, I found that people with eating disorders in general tend to be, highly sensitive people. Although not all highly sensitive people have eating disorders. As far as the prevalence, it's really, really hard to estimate. I thought this was interesting. 15 to 50% of people in weight control programs seem to have binge eating disorders. Seems to be more common in women than men. And it often begins after the first experience with dieting. So dieting isn't really healthy. I'm going to end this, and it's gone too long, but with this really interesting clip of this collegiate football player who I just adore. I wish I could meet him. He came out with having binge eating disorder.
Lewis gets crushed, and it was the kicker who made the hit.
That's right. Welcome back to GMA. That is Joey Julius, a kicker for Penn State University, taking down an opponent from Michigan. He is a fan favorite at my alma mater. The Nittany Lions sophomore, known as much for his size as his ability, is now opening up, though, about his private struggle. And Paula Ferris, I know you have that story.
Well, Larry, good morning. Good morning, everyone. Joey seemed to be on top of the world, popular on campus, yet secretly battling binge eating disorder. It is a life-threatening disorder, and he says it could have taken his life. And Joey just now sitting down to share his courageous story with me.
Joey Julius to kick it away.
Joey Julius is a college football sensation. At nearly 260 pounds, the Penn State kicker's uncanny size and powerful hits make his fans go crazy. What his fans love most about him, his size, is what he secretly hated.
I was always calling myself fat, disgusting, lazy.
A secret that he recently shared in a stunning Facebook post.
I've decided to go public about my absence from the team.
Depressed and anxious, Joey left the team this past spring and checked himself into a treatment center. It was there he discovered why he'd been struggling for the past 11 years.
My name is Joey Julius, and I have an eating disorder.
Joey had binge eating disorder. It's when people lose control over their food intake, including eating large amounts of food at a time, even when not hungry, and eating fast. It's often done alone. How do you respond to learning that you, a man, a collegiate Division I football player, has an eating disorder?
I just said, what's that?
You had no idea what it was.
No idea.
There is a stereotype that eating disorders are quote-unquote women's problems.
I just think it's completely false. I mean, we all eat, you know?
Do you think there are guys out there that are struggling with this, but they're too ashamed to come forward?
Yeah, I would think so. Because I was one of those guys.
In the U.S. alone, 20 million women and 10 million men will suffer from a clinically significant eating disorder at some point.
I think just the fact that being a college athlete kind of pushed me towards like that goal of kind of correcting what was wrong with me.
For Joey, a typical episode would involve eating a salad in front of his teammates, but then hiding food in his backpack, going back to his room alone, ordering cheesesteak, fries, Chinese food, and binging.
I would have to lay down to the point where I was so sick I couldn't move. And just, you know, lay there. Or sometimes I would cry.
Joey, has there ever been a moment where you thought this could kill you?
Yeah, after I think I got the treatment, that's when I was like, you know what, if I would have continued down this path, you know, I might not be here right now.
Now, Joey says this is something he will deal with for the rest of his life. He acknowledges there are going to be some bumps in the road, but when he feels himself going in that dark place, the wrong direction, he takes a step back. He thinks about what he's doing, and you guys, he phones a friend, he calls a friend. He's no longer afraid and ashamed to ask for help, and he's inviting other people. It's stunning, though, that stereotype that these are women's issues.
Right,
It's
no,
not.
not at all.
Not.
I could shocked by that number. 10 million men deal with it. I was asking Michael if he saw any of this in the NFL. I just want to say, Joey, thank you for speaking out.
Yeah.
Okay, so I just want to give that kid a hug and hope he's doing really well these days. So that's the end of this one. Sorry it went so long. I'll finish up eating disorders on the next clip.